me too. Allow me.
Hello, everyone, and thank you for coming and participating in our online virtual summit 2020. You are all welcome. Today, we have something exciting for you, something that was
Yeah.
requested because, as you know, we asked some of you what topics you guys wanted us to discuss, and that's what we did. But first, we just want to know that we understand everything that's been going on. In fact, we almost had to cancel this virtual summit. However, we decided that we would rather make changes accordingly so that we can still bring you guys all of this amazing information that you can use for a lifetime. Just know everything on here will be downloaded live, Facebook, and YouTube. So even after this, you will have access to all of this exciting information. We hope you enjoy yourself. So today we have a
Yeah.
special guest. His name is Dr. Aiken Simwatachela. Doctor, how are you?
Yes. Good. How are you?
Good, 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 good,
Yeah.
good. All right, let's turn some of this music down so we can get started.
Yeah. All right. Thanks for having me. Although, yeah, this lockdown is crazy. Coronavirus has changed everything. Yeah.
Yes, it has, hasn't it?
But I'm glad I could be able to attend your this virtual seminar.
Yes, we are
Yeah.
so glad to have you. And a lot of nurses actually turned in a lot of questions for you to answer.
Oh, is that so?
That's right. So you will be challenged
Yeah.
today with a lot of difficult questions. So, guys,
Let's see what.
what we are going to be talking about today is the relationship between doctors and nurses, because we know often this relationship, right, becomes a little
Yes.
hostile. And a lot of nurses, doctor, feel as though a lot of you doctors out there don't have a respect for us nurses. So we want to know certain answers to some of our questions. But first, we are
Okay.
going to allow you to tell us a little bit about yourself. And doctor, keep it short because you know we don't have much time. And after that, I will begin to ask you some of these questions. Go ahead, doc.
All right. I've been a doctor for over 20 years, and
Mhm.
I've worked with several nurses in several hospital settings and clinics. And right now, I'm into radiology. I think that's the summary of it all.
Yes, doc.
Yeah.
How long have you been a doctor?
Over 10 years.
Over 10 years. Wow. Wow. So you have a lot of experience with working with different disciplines,
Yeah.
including nurses, right?
Yes, I do. Actually. Yes, I do.
Yes.
I do.
And
I do.
how have those
Yeah.
experiences been with you? Have your experiences with working with some of us lovely nurses, the best of the best, have they been
Hmm.
bad or have they been good?
Yeah, they've been good, the good, the bad, and the ugly, everything. But most of it has been good.
Mm-hmm.
And to start off with, I want to say to put up the setting of the expectations that the doctor has. You know, what we have in mind is that the nurses are the ones who are with the patient all day. All right,
Mm-hmm.
they get the handover in the morning from the nurse who's been there in the night, and the nurse is always on the ward with the patient. And
Yes.
so when we're coming to the ward, we're coming with that in mind,
Mm.
that my good nurse has been there all day, and they know what's happening to the patient. They know who's been here and who's not been here, and they are helping to have a holistic care for the patient.
Mm-hmm.
And so that's the first thing that we have in mind when we come to the ward. So, what are some of the things that we want when we come to the ward? First, we expect you to be prepared for us.
Mm-hmm.
All right. We expect you to have your act together. If we're doing a procedure, we expect you to have your trolley or your cart ready. All the things that we need to use for this procedure must be there.
Mm.
Right. So that's the first thing. So if things are not there on the trolley or on the cart, then people get frustrated and start asking, wondering, were you ready for me? Or are you just trying to frustrate me or what?
Mm. Okay,
The
doc, let
second
me
thing,
just
like,
yes. So I just wanted to
The second
summarize
thing,
what the doctor said right now, okay? So what he's saying, nurses, is
okay.
that if he is working with us, and for example, he says, hey, I'm going to perform a lumbar puncture at 9 a.m. in the morning. Your job is that you have to be prepared. He does not want to come and find that you are not prepared, that everything he needs is not on the cart. He wants to make sure that everything is ready to go and that you're not running around during the procedure looking for supplies.
Mhm. All right. The second thing is, we assume the patient the nurse has been with the patient all day. They know about the patient. So I need you to give me information about the patient. I need you to be the advocate for the patient. Okay, you need to tell me, doctor, I don't think this patient is doing well. Or doctor, these are the concerns that the patient has, right? So that's number two. I expect you to have everything together. Do the relatives want to talk to me? Do they want me to explain anything to them? Because I don't want a situation where the relatives are fighting with the doctor because they're saying that the doctor we don't know what's going on with this patient. You're not explained to us. And I think the nurses play a big role in that.
Mm-hmm.
Then number three, we expect you to do the basics, okay? For example, the vitals, are they there? Have they been done? Have you charted the medication that this patient has received or has not received and what is out of stock? You need to tell us who came. In short, have the doctor's orders been followed, all right? And then if the other team members who came to see the patient, for example, physiotherapy was here, radiology was here, you need to tell us what time they came and the reports that they left.
Mm-hmm.
All right. So I think for a start, those are the 3 points that I'm going to bring out. And so it's frustrating to be on a round with a patient who not do the basics. I mean, with a nurse who not do the basics, right?
Mm-hmm.
I think I think that's a minimum expectation as professionals. And the first thing I'm gonna say is that medicine has changed now. Now we have what is called a team. It's a medical team, right? It's a team that is seeing the patient. Okay, way back it just used to be the doctor and the nurse seeing the patient, but now we have the concept of the team. We have the doctor who's leading the team. We have the nurse. We have the pharmacist. We have the physiotherapist. We have so many other speech therapy, nutrition. You see what I mean? Psychology. All these working to see the patient. So now the dynamics have changed, and we're working as a team, and we expect all the team members to play a big role to keep things running smoothly. And I think the nurses, they play a very major role for everybody because they're managing this ward. They're the ward managers, okay?
Mm-hmm.
And they put all the logistics in place.
Okay.
So as a nurse, I think you have a very big role. You need to realize that you have a very big role in making sure this team works efficiently, because you're the logistics manager, you're the patient advocate, you're the ward manager. Yeah, it's a whole big load, I think, on the nurses' shoulders.
Do you think that as physicians, you can function without us?
Well, I don't think so. Okay, like you remember when I started off, I said the nurse is with the patient all day. Okay, the nurse is monitoring the patient, so it would never work if the nurse is not there. It would not work. Okay, because we need somebody to be at the bedside, monitor the vitals, alert the team if things are not working. Okay, and I think in that aspect, the nurses do a superb job. So kudos to the nurses. I think you do a great job.
Great. Did you guys hear that? You guys are vital to healthcare. You guys are essential workers, okay? Essential to the system. So keep working very, very hard. So, doctor, can you please tell us what is the worst you can remember? What is the worst experience that you have had with a nurse?
All right. So I went one day. I went to the ward. I think I was going to do a procedure. Then I went in. First of all, this nurse was not smiling. I don't know if she was having a bad day. Then I asked for things that I needed to use. She just pointed and said, "Oh, they're over there. You can go get them yourself."
Mm.
I flipped my lead. Okay. Yeah. And, but I did not, okay, I don't remember if I shouted at that nurse, but I tried in a very mature way. I
Okay.
tried in a very mature way to make her realize that it was part of her responsibilities to
Mm-hmm.
make things work.
Mm-hmm.
And since she's the logistics manager, she knows where things are, what is in stock, what is out of stock. And because she does the orders, she knows where she keeps things. So she needs to give me the things that I need. All right. So I think at the end of the day, we became friends,
Okay.
although the
Great.
relationship didn't start off well for the reason that I told you.
Okay.
Okay.
All right. So you handled
She was
yourself.
up to frustrate. She was up to frustrate the doctor. I wonder why. Okay. I was coming to see the patient,
Right.
and she just didn't want to work that day. I'm sorry, if you don't want to work that day, please find somebody else who's gonna work with me.
Well, doctor, nurses, we're human, like you. And sometimes I'm not defending that nurse, but sometimes we have bad days, And so when we come to work, it's not that that's our character, but we have bad days and some of us are overworked. And so some of that you see, some of that behavior may be just frustration. Yeah.
Mm-hmm. Yes.
Mhm.
Okay. So, but like, remember what I said. This is a team. Okay. So, your mood affects other team members.
Mhm.
So I think, and then, this doctor's visit doesn't take forever. So I think for the next 30, 20, 15 minutes, just try to make everybody's life easy. Okay. Then you can go back to your gloom. But I'm sure if you're trying to make everybody's life easy and good, your mood is gonna change by the end of the day. Yeah.
Mm. So one of the questions that we had was regarding, how the newer nurses, the nurses that are just graduating, are being thrown
Yeah.
into these settings. And, they are so fearful of the physician.
Okay.
And I've seen that some physicians enjoy that. They enjoy having, nurses that uh, fear them. But my thing for you is, what advice do you have for these nurses? How do you want them to act? What do you want them to do? Because they're new. A lot of times they don't know anything. They make a lot of mistakes. They need mentoring, not only from their staff, right? Their peers, but they often need mentoring even from the physicians as well. So what message do you have to the new nurses that are coming to work with you and other physicians?
All right. So, like I told you, when you have a kerfuffle or a wrangle contention going on between the nurses and the physicians, it's because somebody has not done his part. All right. And so if you're a novice, you just started, you need to let us know. I'm new on the job and I'm still getting my act together.
Yes.
And if there's something that I don't have or haven't done, just please let me know so that I can get it for you. So if you give me a heads up, okay, that shows that this person is willing to work with me, is cooperative, is concerned about the patient, is concerned about our relationship as the team. So I'll be very willing to work with you, and I'll do my best to make your life easy. I'll give you some tips about what will make the team work efficient and not contentious. However, if you don't tell us anything and you're not communicating, the message we're getting is that you have an attitude, okay? And you don't want to do your job. You're just one of those lazy people, okay? And that's not good.
Right.
Yeah.
So what you're saying is that communication is excellent. So nurses, what he's
Yeah.
saying is, if you don't know something, just tell him, doctor, this is my first
Yeah.
week. This is my second week. I have no idea what I'm doing. I'm sorry. I might have forgotten something on the list. I might make some mistakes. So please, just to communicate your
Yeah.
deficiencies with the physician from the beginning and not act arrogant and then you make a mistake, right?
Mm-hmm. Yeah.
Wow. Wow.
Yeah.
Wow. So, yes, I definitely agree that communication is one of the most important things as we work together. In fact, studies have
And
shown
then,
that
uh,
communication between physicians and nurses
Yeah.
is very poor, and that ends up affecting patient care.
Hmm. I think you used one keyword, arrogant. Nobody wants to work with arrogant people, even out there in the world. So I think the nurse needs to be pleasant, and the doctor also needs to be pleasant. So it's a two-way street. If you come on the ward, you say hi sister, the sister is not responding, the nurse is not responding, the nurse is arrogant. Yeah, already that's a bad start.
Mm.
Okay. Even if I came in a good mood now, I'm wondering what's going on here.
Mm. Okay, so one of the other things that we're noticing now, right? And I think everyone can agree
Mm-hmm.
that healthcare is so diverse. So we have
Yes.
nurses and physicians coming from completely different socioeconomic, racial, ethnic backgrounds, religious backgrounds. I mean, you're working with Arabs, Indian doctors, Caucasian doctors, Black doctors, African doctors. And, I think that some of the things that we see is that some of us end up bringing those cultural, right, expectations into,
Mm-hmm.
the workplace. And so when a nurse acts a certain way or when a physician acts a certain way, the other party may misconstrue, right, what that
Yes.
what that person is trying, what that uh, question that doctor is trying to
Yeah.
verbalize, right? The message that he's trying to verbalize.
Mhm.
So I'm seeing that
Yes.
this is happening a lot. So what advice can you give, our nurses, because we're dealing with so many of you, and you're coming from all parts of the world, and it is true
Mm-hmm.
that some of you are coming from, areas where women are submissive, right? And women
Mm-hmm.
are at
Yes.
the bottom of the pyramid, right? Where women are not expected to speak. So it may be difficult for you to have a nurse that voices her opinion.
Mm-hmm.
So what advice can you give to us having to work with so many of you from all over the place?
Yeah, I think the most one of the most difficult situations is when you're working with a person, uh, a physicians coming from areas like Arab areas. I think maybe in what is it called, paternalistic societies. I'll give you an example. I had an attending who came from an Arab area, and this guy expected when he was teaching the residents, he was telling me where I come from in my country. When I come into the conference room, into the room where the where the residents are,
Mm-hmm.
we expect the residents to stand up as I come in, and then I'll tell you to sit down. Okay.
Wow. Wow.
So,
Are you hearing this?
yeah, so it's not just the nurses who are suffering, even the residents. Okay, so depending on where you are attending came from. But I think one of the ways in which to sort this issue out is that I think when physicians come to America, they are aware of the American culture. It's a liberal culture, and hence we expect you to act according to the American culture. And I think these guys are gonna adapt. And depending on the hospital that you're in, we expect the senior nurses to also pitch up or talk on behalf of the junior nursing staff. An example I can use is that, most of the time when the rounds are being done, maybe the physician will come alone. But in teaching hospitals, there are some times when the physicians come, the whole bunch of them is
Mm-hmm.
there, and the whole nursing team is expected to be there. And we expect the senior nurses to talk to the senior doctors and tell them if they have any issues with any of uh, the, the doctors that are on that team, and specifically zooming in on the issue of the culture. Okay, we communicate and tell them, okay, this person is coming from, for an example, Iran or Saudi Arabia, where they expect women not to talk back to them, where they expect students not to talk back to them. But please
Right.
educate them and tell them that this is America. We have free speech. We allow people to speak, and then you're working as colleagues. Yeah. All right. Okay.
Wow, wow. And that goes for all you nurses, whether you're from America, Africa, the UK, you know, doctors
Yes.
nowadays, they come from everywhere, you know, to work everywhere. So this
Yes.
message applies for all of us pretty much. Okay.
Yeah.
So one of the issues that a lot of nurses actually dislike is that we as nurses sometimes feel as though, you know, physicians do not acknowledge us. Okay. For example, you expect us to know you by name, yet you don't take the time to get to know us. You know what do you understand what I'm saying? So I know you as
Okay.
Dr. Sambachucelli here, Dr. Sambachucelli here, but why does it take you 6 months to a year to learn my name? Okay. And we
Mm-hmm.
find that at times to be, you know, very disrespectful that you're not taking the time to get to know us. And a lot of nurses feel as though it is because we are working pretty much under you, right? The expectation is that we better know who you are, right? When you walk into the room. But we also want you as physicians to take the time to get to know us as nurses. Is that something that you understand as being true?
Well, it's a bit tricky. Okay. First of all, it's a professional relationship. So okay, I expect you to know my name, and well, it's different. It depends on the setting. All right. So usually the nurses that I work with, I ask them, well, what is your name? And then of course some people have difficulties in recalling names, but I think like you're saying, I think it's a good practice. I practice that most of the time. I get to know the people that I'm working with by name, and it helps even better to for me to remember the name if people are wearing tags, name tags. Okay, that makes it very easy for me to remember who you are. But I think it's a very good point, and I think most of the physicians that I work with, they try to do that. But of course, there are some okay who are on their high horses, and then I think with time they should do, yeah. Yeah.
Hmm.
Yeah.
You guys have definitely heard us. Okay. Doctor, before I ask you
Yeah.
any questions, do
Okay.
you have any comments that you would like to make before I start taking some of the questions that our audience has sent in for you today?
Okay, I think let's take the questions.
All right.
Yeah.
So we are going to start. Okay. All right. Okay. So the first question I have for you today,
Yeah.
Doctor.
Sorry about the all sorts of things going, yeah, on. Don't worry.
Okay.
We are in a working environment.
Okay. Doctor, I had a physician yell at me the other day, and it almost made me come into tears. Okay, I'm just reading what she's saying. It almost made me go into
Yes.
tears, right? I guess she almost started to cry. I felt really, really bad about it, and I felt humiliated in front of my coworkers. Why did he yell at me like that? And what can I do to stop him from doing it again?
Okay. So I think that one of the issues that we frustrates the physician is when a nurse is not able to do the basic things,
Mm-hmm.
right? I come to your ward. First of all, your trolley is not ready. I'm asking you, so what has been the hourly, tell me the hourly trend of the BPs in this patient? You don't know?
Mm-hmm.
Okay, uh, did you do the telemetry? You don't know? Did radiology come and do what they were supposed to do? You don't know?
Mm-hmm.
Okay. How is the patient doing? No, doctor, I just came today. I don't know.
Mm-hmm.
Did you not get a handover? So the thing is, what frustrates people is if you can't do the basics, right? So if you haven't done the basics, that's where the issue starts, right? And then now it's downhill. The second thing is communication. If you are new, you don't know about the patient, they've just put you as an ad hoc nurse, you need to communicate and tell us. They just put me on this patient just now, and I didn't know much about the patient. So Please forgive me. I'll help as much as possible, and then we can get to know the patient together. Okay, I hope they don't do this. They don't do this to me again.
Mhm.
Or I'm a new nurse, so I'm still learning what to do. So doctor, please help me so that we work together. I like working with my patients. I like helping my patients, but I'm new. Okay, I'm still learning. So if you communicate to me and tell me what the issues are, what the encumbrances are, and then I'm gonna accommodate you and know that if you're upfront, you are ready to work. Okay, it's not that you're just or you don't want to do your work, but you're ready to work. You just need help, and I'm gonna help you. But if you don't communicate to me, I'm gonna think you're doing this deliberately. Okay, and then now it's gonna be a fight.
Mm.
So to answer the question, what brings contention is because people don't do the basics. And the second one is people don't communicate if there are any things not happening.
So, doctor,
Okay, I
are
think
you
I'll stop there.
blaming in that situation? Are you blaming the nurse?
I'm not blaming the nurse. I'm saying when we're working as a team or we're working as an individual, there are different situations which bring about contentions in the workplace. For example, the new nurse, okay? The new nurse is still getting to know the job.
Mm-hmm.
But if she has not told me that she is new, okay, and the basic things have not been done, okay, I'm gonna have certain perceptions and think maybe this person is not serious, is doing this thing deliberately, he wants to frustrate me, and therefore my reaction that is gonna come is gonna be, of course, now I want to find out why are you doing this, okay? Why don't you have this? Why don't you have that? Okay, that's the first point. And then the second thing is now you're working with an experienced nurse who knows what they're supposed to do. So why haven't they done the basics?
Mm.
So I think one thing that we need to understand, guys, is that there's no way a fight can start if nothing wrong has happened. Okay?
Is it
So
okay for a nurse
it's
to get yelled at?
no, I think yelling is not good at all. We just need to ask in a professional manner.
Mm-hmm.
And find out what is wrong, why things have not gone the way they're supposed to have gone. Okay, so if the nurse hasn't done anything as the doctor, I think the doctor should just ask nicely and say, don't we have this and this and this and that? Or Becky, why didn't you do this? Okay, and then Becky is supposed to give an answer. Now, if Becky doesn't, just says, I don't know. Now, so you also need to come out respectful. The nurse needs to have a respectful tone. Okay, you need to answer the concerns of your physician so that they know that you're interested in working with them and you're not just disrespecting them.
Mm-hmm. Okay, I have another question for you, and this one is really, really funny. Doctor, it seems as though nurses do more work than the physicians. Why is it, though, that I get paid so little and I'm struggling, yet you get paid so much money? Don't you think that it is unfair for some of us nurses to make what we make?
Well, that's a very good question. You see, the thing here is, wow. I'll give an example. There was this guy who I think it was Mr. Ford or somebody, one of those car making guys. Okay, he found a guy struggling for 9 hours trying to fix his car. This guy was on the road. The car had broken down. He had struggled for like 8 hours to try to get the car back to start running. And when this experienced guy came to help him, he went to the place where he just knocked on some part of the car and told the guy to start the car, and the car started right away.
Right.
So when we're seeing the patient, it's about the technicalities of this patient. Okay, he knows why, can handle anyhow. So I think part of the physician's work is to know why. Okay, why is this happening? Okay, so there's why, then there's the how. Okay, the why is the technical aspect of it. Okay, knowing the actual processes going on. The how is doing things, putting up an IV line, okay, giving the medication, So I think it's about the training. Okay, I think I might not give a comprehensive answer, but I think one of the reasons is physicians are trained to know why. Okay, things are happening. Okay, so if you know why, then the next thing you know what to do. Okay, so the diagnostic process, I think one of the things is the diagnostic process. If that has not happened, if things have not been figured out, then the patient will not benefit from anything. Okay, so we need to know which medication to give and why. We need to know which intervention to give and why, and that takes time. I'll give you an example. If a person needs to become a radiologist, okay, you go to med school, you go to residency, it takes forever, right? It takes so many years, and it takes so much, you get so many loans, and you get so much, most of your time, you spend most of your time learning. And I know the nurses also spend most of their time learning as well, but I think it's about the role that is played that you play on the team. And it's not entirely true to say that the nurses don't get paid equally paid. I think the investments for nurses in the US are quite quite good. I think you
Probably the
agree
best.
with me on that point.
Oh yes, I get
Yeah.
paid pretty well, so I have no complaints in that area.
Yeah.
So wow. So you've really given us some really great points. Okay. So now we want your advice, because I have a nurse who sent a question in, and what they said was that they wanted to report a physician. Okay. Because this physician decided to enter a patient's room without washing his hands and without putting on his gown. And this patient was in isolation.
Yeah.
And she approached the physician and she said, "Sir, this is an isolated patient, so you need to put on your gown, and everything that is written on that door before you enter." The physician refused and walked right in without putting on his, his PPE and all that. So what do you think this nurse should do? How should she go about reporting this situation?
First of all, it depends on how that nurse approached that doctor. Okay, so I know I can forget to do things. I can forget to wash my hands, put on the gown. So you just and that has happened several times. So just tell me, "Oh, hi doctor, how are you? Please remember, this is an isolation room. We need to. Did you remember to wash your hands and put on? And here's your gown. You see what I mean? So first of all, it's your communication skill, how you communicate with the doctor. Secondly, if you have reminded me and I'm not doing what I'm supposed to do, I think you need to take it to the next level. you need to tell me that you're going to report me because you have told me nicely what I'm supposed to do and I'm not doing it. Okay, and I'm putting the patient at risk. So you see, there are two things that I've talked about here. The first one is how the way you need to remind me. Okay, you need to remind the physician nicely, and we'll comply. Okay, most of the times. Yeah.
All right, doctor.
Yeah.
So I'm being told that we are officially out of time for this interview. Doctor, we look forward to having you back for a part 2. Do you have any closing remarks for us before we go?
All right. So, guys, the nurses, I think, to summarize this issue is we usually have conflict with the doctor-nurse relationship because people don't do the basics, right? So we expect you to do the basics, prepare for the round or the procedure that we're going to do. 2, communicate effectively. If there's something which has gone wrong, let me know in advance so that we are on the same page. And 3, do the basics. Okay, if you do the basics, I don't think we're going to have any contention. I like working with nurses. I think nurses do a good job. I think you're the best, and we cannot do without you. Thank you very much. Yeah, for the good work that you keep doing.
All right, then. Thank you for having us. I guess we'll see you later, Doc. Bye-bye.
Okay, bye. Thank you.